Hi, I'm Brian Lane, certified podorthist with Dr. Comfort. Understanding the overall process and the modifications as well as the materials used in custom inserts will help you with the overall success of your program. In this video, we will first start with the overall process to make those inserts from the start of getting those custom impression foams from you all the way to the final product of that coming to you. The second thing we will talk about is the modifications that you can order with our custom inserts, including toe fillers and the materials used. We hope that this video helps you in the overall success of your program. Thank you.
Once we receive the impression set or slipper cast, we scan the image. That image is then sent directly electronically to our CAD specialists. Those individuals take the image and remove the debris captured from the scanner. The image is rotated to adjust the height of the arch and add any flanges or heel cups requested. The adjusted image is then sent to our milling machines. The milling machines cuts 3 sets of left and 3 sets of right at a time, and it takes approximately 10 minutes. For the purpose of the video, this has been speeded up. Base layers are then removed. The excess material is then trimmed. The top cover has been added, as well as any needed modifications, such as a metatarsal pad. The excess material is trimmed once again. Now, grinding the excess material to make it smooth for your patient's comfort. And finally, the arch is developed with a natural curvature to better fit in the shoes.
Now I would like to review with you some of our more commonly used materials and our commonly used custom inserts and the modifications used with those. Now, as I review each of these, all of these can be found in our Dr. Comfort's lab catalog. These are available upon request, just calling our 800 number. We'll be happy to send you some of these to assist you further with the information that I'm providing here today. Now, starting with the materials, the first material is this yellow EVA. This EVA is a 45 durometer base layer material used most commonly for most custom inserts. The next one is a 55 durometer EVA. This is going to be used for a little bit more shock absorbency for heavier or even more active patients. The next material is a cork. This cork is actually used for toe fillers as a base layer, a good supportive foundation. The next material is a P-cell. This P-cell is usually the top cover for some of our custom inserts, including our toe fillers. The next one is a tri-laminate, which we'll cover with in a few minutes. This next one is a blue plastizote. This blue plastizote is most commonly found in our custom inserts top cover. And then we have also some Poron. This Poron is used as a shock absorber. And of course, we've got the plastizote with the Poron. Now, reviewing each of these different inserts, a standard insert you get from Dr. Comfort without any sort of modifications or anything done to the insert. If you just request an insert, this is what you'll get. You'll get a standard insert with a blue plastizote top cover and a standard EVA bottom cover, yellow EVA bottom cover. This would be a standard insert. Additionally, what you can ask for would be what's called a sulcus length or 3/4 length, where this would provide a little extra depth in the toe box for the patient who requires, because of say a crossover toe or a hammer toe, so just a little extra depth. Additionally, if a patient requires a little bit more support in the base layer of the insert itself, if they're over 200 pounds or very highly active, which is very important you fill out those forms properly, but if you fill that particular form out, we will actually, this will come standard for those patients above 200 pounds and very highly active. It's very supportive for the patient, and this white EVA is a 55 durometer, more supportive. Additionally, what this insert actually also happens to have is a metatarsal pad or an anatomical pad in there, and again, offloading forefoot deformities if the patient is required or as the prescription states. Those pads look like this, such as an anatomical foot pad like this one, or even a metatarsal pad, again, to offload forefoot deformities. What could also be done is also a sulcus length for the EVA, 55 durometer EVA material. In this case, it actually has a Poron material on the bottom and even some forefoot padding on there as well. Now, if a patient has a deformity such as an ulcer or some sort of wound under the first metatarsal head, in this particular case we've offloaded that specific area, and you'll see the Poron on there as well, good shock absorbing material. This would take pressure off of the first metatarsal head as that patient is ambulating. This insert is a tri-laminate insert. You'll see it's 3 different materials in there to make a tri-laminate. This would be for a patient who requires extra padding or has a condition known as foot pad atrophy, and this would again benefit that particular patient. Other modifications that can be done on our shoes, our insert specifically would be having a heel raise. This is an adjustable heel modification. You could actually peel off specific layers if the layer is too high, and that could come with the inserts themselves. Now, that all being said, with all those modifications that can be done, including flanges, if you want a higher medial flange or a deeper heel cup, we could also do those, and those are all at no additional charge with Dr. Comfort. Now, something that is an additional charge would be our toe fillers. This is actually a different billing code, where these are more of an A5513. This billing code is an L5000 code. This is our toe filler for patients who are missing digits. In this particular case, the patient would be missing, this is the left foot, they're missing the great toe in that case, so a filler has been added for that patient to ambulate more successfully. This would be a transmetatarsal amputation, still billed the same way as an L5000, and again you'll see the cork base layer as well as a tri-laminate type material in there, and that is a very supportive, very sturdy, very well made custom insert, that being a toe filler for that patient. So those are our most common materials as well as modifications that can be added to our custom inserts. At Dr. Comfort, our goal is to ensure that you have a successful therapeutic shoe program. With that in mind, we've developed this video to assist you with the custom inserts and toe fillers that you dispense in your office or clinic. If you have any further questions about anything that you've seen in this video, please feel free to call our customer service number at 1-800-556-5572. Thank you.